Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about onychomycosis or fungal toenails. This is a common problem. We've talked about this before, but I want to go into a little bit more depth of kind of what's going on. The idea with fungal toenails, onychomycosis, is it's an infection of fungus in the nails, and the typical cause of this infection would be a tinea type infection. Tinea rubrum is the most common, and it's basically the exact same fungus that causes athlete's foot. So how would this present? Let me give you a personal story, a personal example. When I was in Brazil, my feet were commonly wet. They were wet all the time. A lot of times we were in shoes, walking in puddles of water. And when I returned home, I had a really, really bad athlete's foot to both feet and had similar infections in the toenails. So the nails would get thick, discolored, white. Sometimes they'd be crumbly from this fungal infection in the nails. And so no matter what I did to treat the athlete's foot, the fungus would return because it was sitting in the nails. And the topical treatments, the sprays, the powders, all the things you use for an athlete's foot weren't working very well on the onychomycosis, on the fungal toenails. And so I started looking for other options. And the good news at this time is I entered podiatry school and I had access to a newer medication called Lamisil, terbinafine, and this Lamisil actually did a phenomenal job over a period of 3 months of resolving the fungus in those toenails. Since that time, I've reviewed and we've gone through lots of different things. There are multiple medications that have been used for athlete's foot and fungal toenails. Lamisil or terbinafine seems to be the best one. It's about 85% effective, but it works really, really well. It's what I used. In their initial studies, they had some liver side effects, so they do recommend at least monitoring your liver. However, it is now no longer required that you do a lab test before you start the medication. Because the liver is such an important organ as far as I'm concerned, I will usually do the test at least in between. Sometimes I'll do it before they start, and at least do it at 6 weeks to ensure that the fungus medication is not affecting the liver in any way. So that's one. So those medications, terbinafine seems to be the best. They used to have Sporanox. It works in some situations. It's not used very often. It's less effective, usually in the 65 to 70 range. Rhizofulvin can be used. Sometimes that was what we would use in children because it's safer, but at the same time, it's not as effective on fungal toenails. There are some topicals that work, and there are newer and newer ones that seem to work. Most of the topicals are not super effective. I also sometimes will have individuals utilize melaleuca or tea tree oil on the nails, and this seems to be quite effective as well. So if you have a fungal toenail, it is important that you treat the fungus if you want it to resolve, because otherwise it will continue to spread. It can get worse, and it can make ingrown toenails worse, can make athlete's foot worse, and so forth. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 346, onychomycosis or fungal toenails. If you'd like additional information, you can reach out to us at utahfootdoc.com, and there are additional resources. There is also soon to be a significant resource that you can do for this type of problem that'll give you additional insights on nail health and nail treatments. So watch for this. It will be available through this channel. It will also be available through utahfootdoc.com.